Glaucoma is a disease that happens when the pressure in somebody's eyes, not their blood pressure, but their eye pressure, gets higher than their eye could tolerate. And if this happens for a long period of time, it starts to kill off what we call the nerve in the eye. And the nerve in the eye is the most important part for seeing. So we call it glaucoma when the pressure causes the nerve to die out. And the most common type of glaucoma is called primary open-angle glaucoma. And we can't find a cause for it, it just happens. So this is the kind that we have to look out for. But the overriding thing about glaucoma, the standard type, is that it gives no indication that it's coming on. So it's imperative that patients get seen regularly, that is your annual check, so that we could pick it up for the patient, because you cannot tell if your eye pressure is elevated just by feeling it or by sensing something. It has to be measured directly. Primary people at risk we start with would be people who have a family history of glaucoma. So father, mother, brother, sisters, aunts. So if one has a family history of that, one should be seen, have their eye doctor regularly check them. Then the next category of people would be people who are short-sighted or myopic. They tend to have an increased risk. Then people who are of West African origin have a slightly increased risk of developing glaucoma. And then we now go to the things that are measured. People who have a higher eye pressure have a higher risk of developing glaucoma. And in people who have had injuries to the eyes, these are different now from the standard types. These are glaucomas caused by injury. People who have injuries or certain types of infections. Glaucoma damage cannot be reversed. However, we're able to stop it from progressing. And the very good news is if we have tests to see if someone is at risk, and we could stop it from developing. And we do this by lowering the eye pressures. And the primary way we lower eye pressures for the majority of the population is by giving them some eye drops. We have several different kinds that we tailor make to suit. So by regular use of eye drops, we can lower the eye pressures. Now we also have additional treatment that can do the same thing, which include certain types of laser treatments. And in cases that we don't get the response with the eye drops and the laser treatment, we may need to go on to surgical procedures to get the pressures lowered. Because as we discussed before, the lowering of the pressure is the only thing we could control. And by lowering it, we could prevent the progression and the worsening, and also the onset of glaucoma. The advice is very simple. You cannot manage glaucoma on your own. It requires specialist care, so you have to keep your appointments. All of the tests are required, adherence to medication, and until the ophthalmologist has determined a proper plan is working for you, one cannot stop treatment, truncate it, and come back several years afterwards. That is asking for disaster. So it's a long haul thing, but you will have support along the way, because this is what ophthalmologists are trained for, and we have a lot of effective tools to prevent the disease from progressing and to arrest it.